Hello, my friend. Vinay here, lecturer of exercise science at National Strength and Conditioning Association, India, a body transformation and performance coach. Here to make your transformation journey easier, faster, and enjoyable. And today is not just an episode of Fitness Engineered podcast. Today we have a special guest with us who is an actual doctor who has worked with almost thousands of clients and patients and has been in this field from a very long time. We have Dr. Bilal with us, who is super knowledgeable, who has got ton of value to offer us, and this podcast episode is going to be super cool. We are going to discuss about the new weight loss drug, that is a prescription based drugs. We are going to talk about whether medicine and the traditional practices that doctors are acknowledging these days, are they actually going to solve the problems that we have, or are they just curing the symptoms of the problem? What are the right ways to diet and exercise? What are the ways that will lead you to long term success in your transformation, health, and fitness journey? So, without further ado, let's get back into the episode and let me introduce Dr. Bilal to you. He is someone who could introduce himself in a better way and not let me go through his education and just mispronounce all of the stuff that he has did so far. So I'll get Dr. Bilal on screen and let him introduce himself and watch this episode till the end for super valuable episode. Let's go. Dr. Bilal, welcome to Fitness Engineered Podcast. And how are you? How are you doing?
Thank you, Vinay, for introducing me to everyone and also welcoming myself to your podcast. So I'm doing great. So myself, Dr. Mohammad Bilal, that's my full name. I come from South India, from Kerala. So I am basically a doctor who's done my MBBS and my master's in pediatrics, which everyone knows as a child medicine. After that, I have done my super specialty neonatology, that is taking after neonates or newborns in a tertiary care NICU in one of the reputed hospitals in the country. And I have an experience in my medicine field for almost 17 years. Along with that, if you
Fantastic.
ask
Almost
about
2 decades. Almost 2 decades, Dr. Bilal. Super experience.
fitness, it started from my 16 years of my age, where my first client was
Oh,
at my age of 17, and my
man.
online business started at 2020. Now, in last 3 years, covered more than 2,500 clients, and I have done
My God.
roughly 5 to 6 certifications on the same fitness aspect as well. So that's a small introduction.
That even though the introduction was small, it was too deep, and the experience that you carry, the expertise you carry is tremendous. We want to learn a lot from you in today's episode, want to get clarified about a lot of the topics, a lot of the misinformation in the field that no other than a doctor who is an MD could help us understand. Super excited for this episode.
Let's start it.
Awesome, awesome, awesome. So, Dr. Bilal, you are a proper doctor. You have done your MBBS, you have done your MD. So, what do you think that the traditional medicine approach, the traditional approach that doctors are using these days to treat the problems like diabetes, to treat the problems like hypertension, to treat the problems, these are the problems when doctors are suggesting the clients or the patients that once the medicines start, then you'll have to take it for the rest of their life. But according to me, what I think is these medicines are not solving the actual problem. That means anti-hypertension medications are not helping the patient to solve their hypertension problem. That is just curing the symptom, or else that is just preventing the problem from getting escalated. Okay, that is not solving the problem in the first place. Same goes with diabetes, same goes with all the other stuff. So what do you think as a doctor, that what should be the solution here? Are these problems really solvable, or are these problems something that will have to take medications for the rest of our lives?
I'll answer this with an example. So, a person who has experienced both aspects, being a coach as well as being a person from medical school, people consider doctors have knowledge in every aspect, but the answer is no. Each doctors are specialized in a particular field and they are the best in that field. Now, if you ask me a doubt on gynecology, I will not be the best person to answer that. So when you go through medical school, what happens is there is nothing taught on nutrition. There is nothing taught on
Oh,
what is the baseline things to be done, which will optimize your human health to its maximum. Only in one of the subjects in year 4 of MBBS, they teach something surrounding your nutrition. So what happens when you go through your MBBS, MD, you do your specialization and you get a diabetic patient, you know how to take care of that patient or how to just improve the symptoms. For example, if a diabetic patient approaches a endocrinologist or let's say a diabetologist, he's going to give drugs which will help insulin attach to its receptors or for proper insulin release. Or the patient might go into insulin intake where the dosage will be high or low. Patients taking multiple shots of insulin in a day. But the example I want to give here is, let's say a person is having pneumonia, which is the infection of the skin of the lung. Okay. And the patient comes to you with fever and you give the basic paracetamol for fever. The fever is going to go in roughly 6 hours, 4 to 6 hours. But
correct.
until the pneumonia is treated, this fever is not going to go. So here the doctors just advise on what to do with the medications, how long to take. I have seen patients taking medicines for 30 years, 40 years, 50 years.
My goodness.
And coming to the current scenario in India, I'm not going worldwide. In India in 2023, 10 crore people have diabetes. Roughly
My God.
13.6 crore people have pre-diabetes. And more than 3.36 crore people have hypertension.
My goodness,
So
those numbers are so crazy. And even one thing I would like to add in, so sorry for breaking you or cutting you here, is these are the diagnosed numbers. There are majority of people in India who are undiagnosed so far. They don't even know that they have these problems. Am I right?
now the diabetes has crossed 10 crores and pre-diabetes is almost 13.5 crores. And in 2045, the projection is estimated to from 10 to 14 crores of diabetes in
My
next
goodness.
10 or 15 years. But what we should think here is in next 15 years, your healthcare is improving. Number of doctors are
Correct.
improving. Number of lifestyle coaches like you and me are increasing. People
Correct.
have more knowledge now. After COVID, people are more aware of health, but
Yes.
still the numbers are increasing, so we know something is going wrong somewhere. So
Correct.
instead of giving the patient medicine along with that, because medicines have a huge role in controlling a disease, it is
Correct.
not that you don't take medicines, but along
Exactly.
with this, the basic stuff should be reversed. So if you ask a diabetologist, what should I do with my nutrition? The answer is going to be avoid rice and take chapati or avoid rice and take
Correct.
oats. That is not the answer you should give. And if a person asks, what should I do with my training? They'll say, walk morning for 30 minutes. So American Heart Association advises to do 30 minutes of moderate walking at least 5 times in a week. But
Correct. That
what
is
is
150
missed here
minutes of
is,
activity.
correct. What is missed here is they also advise you to do resistance training. They also
Correct.
advise you to be active throughout your day, which is not taken care. Even though it is taken care, doctors doesn't know how to explain this to a patient or how to craft it for each patient.
Correct.
So we should start from the baseline where you start with medicines, you start with lifestyle change, and if the medicines can be slowly, if it can be tapered down over months or years, I would say yes, diabetes can be reversed, because in my coaching I have reduced the insulin dosage of many patients. I have
Awesome.
reversed pre-diabetes to a normal scenario, and I have found out multiple people with insulin resistance, which is the
Oh,
stage before pre-diabetes.
correct.
Vinay, I said you in 2045, the projection of diabetes is going from 10 crore to 13 crore. Correct?
Correct.
In this,
Correct.
57 percentage is going to be undiagnosed. 57 percentage.
My goodness. Let me have a sip of water to digest these numbers.
Percentage should be diagnosed by using some means, or else this is also going to go into pre-diabetes and finally diabetes. And not to mention, India is the diabetic capital of the world, and
Correct.
the scenario is getting
Correct.
worse and worse. So answering your question in
Correct.
short, it is reversible, but not just with medicines, but a lifestyle change crafted separately or differently for each person along with the medicines.
That
Yeah.
was super detailed question, and that hits the nail on the head. Okay, because nowadays what I am seeing is, I am seeing doctors just pushing medications. I am seeing coaches, they are against the doctors. They are going against the doctors that you should not take medications, medicines are not good, medicines are bad, once you start taking it you will not be able to come out of it. But both the things have their own rule, right? It is not comparable. The medicines and the lifestyle change both are not separate entities, but rather if we look at it from the same lens, if we work around both of these things, the overall effects would be much better than what any single one of those could be. That's what we come to as a conclusion of this answer. Rather than going just lifestyle, nutrition and everything, yes, this could have a change, very impact, very big of an impact, but medicines would also play their own role. They are apple and oranges, we cannot compare both of those, but if we take both of those and have someone who will guide us correctly through both of those, that would be the most optimal approach, I think. What do you say?
This I'll answer with a definition given by WHO in 1948 regarding health. So always WHO advises to go on a multidisciplinary or a holistic approach to health. So you have multiple
Awesome.
entities in health, which is not just physical, it is social, psychological, mental as well. So lifestyle coaches or fitness coaches should work in a multidisciplinary approach along with doctors and other social workers as well if you need. So it is not just one person can reverse everything and can cure every problems in the world. So if you are a fitness coach, now you spoke about you started my own health school. So the main aim of this health school is fitness coaches should be able to converse with a doctor in medical terminology so that finally the patient is getting benefit, so that they work in a multidisciplinary approach. And as I said, medicines is also needed, which should be tapered over time, should not be passed to the next generation. Because if a father and mother has diabetes or any other lifestyle diseases, I can say roughly 20 to 30 percentage more chances for the next generation to get the disease compared to a person whose parents doesn't have the lifestyle disease. So these people will be responsible for giving this lifestyle disease for the next 5 to 6 generations. So we
My
should
God.
be able to reduce this medications, taper it, stop it, meanwhile improving the lifestyle. So it is a multidisciplinary approach. Yes.
Amazing. That was a really, really good answer from you. Super detailed, but very easy to understand. And that is what we as coaches should be looking at. Okay. Because one of my approach when it comes to coaching my clients and everybody is, what I believe is that the best coaching is where the clients don't need coaching at all after a time. Okay, they should become independent, they should understand their body, they should understand their nutritional demands, they should understand how to exercise, what to exercise, how much to exercise, when to rest, when not to rest, and all of those things. So I think your approach is also quite similar, because I have been seeing you doing this from a very long time on social media, on Instagram, that you are teaching. Teaching is also one of the fundamental of our coaching process. Okay, and that is very, very important, because that is what is going to guarantee the results would stay for the long term, right? Because if we are in school and we don't learn mathematics, we don't learn how to add, how to subtract, how to multiply and stuff, if we don't practice all of those things, how can we be better at doing all of those things just in our mind when we grow up? It is about that learning phase that has to be there, and that has to be a part of all of the coaching processes. But these days what is happening is people want quick results. They want quick results, they want their diabetes to go away, they want 20 kgs of fat to just go away within a few months or within a few drinks. So what do you think should be the best approach from client's point of view? How should they approach their fitness transformation, weight loss, or getting off medications or lowering their doses? What should be a client's approach towards transforming their health, their fitness, their physique? What should be the approach that a client should take before going into any of these or hiring a coach?
question. So I always like to give examples, Vinay, so everyone understands it very easily. So
Yes,
let's say you see a primary school where they are taking admissions for LKG. Let's say 30 students
correct,
are joining in a class. None of
correct,
them know anything. So the teacher starts with A, then goes to B, then goes to C, and then finally they reach to Z. So
correct,
you can't ask this 30 students to have an idea and come to the school, because it is the teacher's responsibility to understand these children doesn't know anything, and we should start with
correct,
alphabets, the basic stuff.
correct,
So when we get any clients, it doesn't matter from where, from which part of this world, it is human anatomy everywhere in this world. Correct?
correct,
So these people are, or your potential clients or prospects are, LKG students in the fitness world or health world. Understood?
correct,
So when they come as a teacher, it is your job to teach them or to give the awareness on what to expect. So you said what we learn in school, we should be able to learn it so that we do it or we teach others. So
correct,
in this world, whoever is doing a job, their main role is to communicate proper with the person whom they are giving their service to. Let's say I am a doctor. A child is coming, or the parents is bringing their child and getting admitted in the ICU. It is my job to explain to the parents in simple language what the child has problems, which I learned from my medical school, where I
correct.
don't use any medical terms, which makes the parents understand what is the problem. I'll give them two options for treatment. I'll give them that estimated time what is needed, which will make the treatment go very easy. But if you start making it harder, the parents won't understand anything. Communication gap happens, and then problems arises. So even in our fitness field or coaching field, or even if you go to school, proper communication is needed, where everything should be broken down into simple language. Meanwhile, the moral of the story should be conveyed to the prospect or your clients. So it is not how they should approach. They will approach in 100 ways.
Correct,
Every person is different. Even if you go to a household, five people in the same household will be different.
correct.
So whatever they say, yes, we will intake them. Once they join your school or your coaching, you are the teacher now, where you should teach them how you teach a LKG student, graduate them to 12th standard, and then leave them to take care of themselves. So that is our job,
Amazing.
not, yeah.
Amazing, amazing. Very, very rightly said that it is the responsibility of we as coaches. And majority of times now, I am a lecturer. I meet a lot of nutritionists, coaches, physios. I set up their question papers. I take their exams, and what I find out is that majority of them are going towards the most optimal stuff. Now, 2 grams per kg of body weight protein intake might be the optimal stuff, but is it followable for a person who has been just eating less than 50 grams of protein every day? The optimal is not practical for everyone in every phase of their life. So the approach should be tailored towards the client that we are getting, and it is our responsibility at the end of the day about how we communicate to our clients and setting the right expectations and taking them ahead from there. Very rightly said, very rightly said. That's great answer. I would also like to know, Dr. Bilal, that as a client, because we have a lot of our listeners who are not coaches, who listen to this podcast because they want to improve their health, who want to improve their lifestyle, wellness, and they want the answers to their nutrition problems and all of those things. So, as a client, as a person who is not a coach himself, how should they approach the world of nutrition? How should they avoid all of the misinformation? How should they cut out all the noise? And what should be they looking at when they want to find a good source of knowledge or good source of information, and how they should approach this?
Answer for this is what they did in school. Again, I'm going with an example. They did not try to learn first standard and second standard by themselves. So, whatever you want to approach in life, find a teacher which is affordable by you or which is based on your likes. So, for example, you come to social media, you will find multiple people. Now, they can see
Correct,
you, Vinay. They can see many people who we know in common. They can see me. So, if you hire a teacher, less likely you are going to spend the next 10 years doing things wrong. rather than choose a teacher who will teach you what is correct, what is wrong, and in the next 6 months he is going to make you a version which he learned for the past 10 or 15 years.
Correct.
Whatever you want to learn in this life, you find a teacher. That is the shortcut to reach your goal in any aspect of your life.
Fantastic. Very rightly said. Very rightly said. Because even we as fitness coaches, we as professionals, even if we are at a point in our life where we are teaching other nutritionists, other coaches, other peoples, we ourselves are learning stuff. Our learning journey did not stop. We are still learning, we are still improving, and fitness, health, nutrition is something that now we have become slightly good at. But there are other things in our life that we still need to improve at, and there we both are someone who has hired people, who has taken up coaching for the other aspects of our life, as in terms of business, as in terms of other stuff. So that part is very very important. Nowadays people don't understand the fact that we need coaches to get better, we need teachers, we need someone to teach us if we want to shorten the learning curve, if we want to bridge the gap between getting the results and the uncertain path about how to start the journeys. So that is very very important, and very rightly said by you that finding a teacher is the shortcut to achieve anything in life, no matter what it is. So that was very nice from the client's perspective. I have one more question for Dr. Bilal, that we have been listening and seeing a lot of cases these days of young people dying of heart attacks during workout, during their gym, and even when they are at home. But a lot of young people, how are they suffering from heart attacks? And majority of these cases are linked with working out population, exercising population, and the people who are a little more health conscious. What would you say about this?
I would like to say this is not common in people who work out. This is only portrayed in social media or in news channels where something happens when a person work out, that is portrayed more. For example, you see deaths of people who are bodybuilders, then that is portrayed more. But
Correct.
other than that, there are multiple reasons of death in this country which is not portrayed. So
Correct.
always I give an example. You have road traffic accidents more than COVID deaths. That doesn't mean you're not going to go out in the road in a car. Correct.
Correct.
So coming to young people dying with heart attack, or what we call as MI, myocardial infarction, or coronary artery disease.
Correct.
It is not new that people below 40s are getting these problems, but it has been increasing. Now, studies are showing roughly out of 5 deaths of heart attacks or any cardiac issue, 1 out of 5 will be people below 40 years. And this is increasing by 2% every year. So, if you look at the causes, it starts from lack of awareness, because in schools, there is nothing taught on this. In
Correct.
schools, they keep on teaching still now about geography, history, everything outside the world, but about
Correct.
basic nutrition, basic lifestyle habits, nothing is taught. How to sleep better, how to manage anxiety, how to take care of your future, how to behave with your peers. Nothing is taught in detail. They are just focused on many things which is actually not needed in future as well. Now, as a person who is a doctor, I did my mathematics till 12th standard, which is of no use for me, but it is useful for some other people.
Correct.
So coming back to this, causes are many things. So primary causes, the 57 percentage which I said is undiagnosed of diabetes. They are in a
Correct.
stage called insulin resistance. So these people, most of them are overweight and obese. More than obese, I would say in obese class 2 or obese class 3. So
Correct.
their fat tissue in the body more around the hip and waist, which is more taken than BMI now to determine the risk factor for your
Correct.
heart disease and all. These fat cells produce hormones, they trigger inflammation, they cause insulin resistance, and this insulin resistance is undiagnosed by a vast majority of 57%. So becoming unaware of this topic, because at least in a day going through 15 to 20 consultations, 100% people are unaware of the condition called insulin resistance.
Correct.
So this is one of the major issues going into pre-diabetes, diabetes finally complicating to a heart issue. Second is your hypertension, which I said is almost 36 crores now in India, which is 3 times more than diabetes. Affects
Correct.
every part of your body. especially your heart can go to a stroke, or a heart attack can affect your kidney as well, going into a dialysis and all. Then what happens is you're smoking, and now a
Correct.
young generation have the behavior of vaping, e-cigarettes, which
Correct.
shows has 34 percentage more chance of getting heart attacks when compared to traditional cigarette smoking.
My God.
4 percentage more. But people still think it is healthy, and we see even restaurants having your hookah smoking, which also has nicotine. So
Correct.
people have taken this as a lifestyle, but they are not knowing they are digging their own grave. So these are some of the causes. Then it can be anomalies. You have some structural problems in your heart which is not
Correct.
checked. So I would say after 30 years, you need to do routine checkups. And especially as I am a lifestyle coach, you are a lifestyle coach, some of the coaches will be hearing this. If any of your clients are fainting in the gym without any clear explanation, you should look for heart disease. If they are having shortness of breath, don't think the exercise is hard, that's why they are having shortness of breath. It can be either an asthma or it can be an heart issue. Then if they are
Correct.
complaining of chest pain, don't think it is because of the chest exercise they did it yesterday. It can be anything regarding the lungs or the heart. And you should take the family history of the client who is approaching you, not just the client's parents, the client's mother's full family history, father's full family history, the client's siblings. Everything should be taken in detail. If there is family history of heart disease, more chances he or she will have a heart disease. So trust me, there are multiple causes which is finally leading to this. Finally,
Correct.
coming to an example where one of my client who is a female, 35 years old, who has asthma, and she approaches a female trainer who gives her high intensity interval training from day one, which is not advised by American Heart Association, and she worsens her asthma, chest pain increases, and she gets admitted in the ICU.
My God.
Coach, you should have the basic, at least the basic knowledge of some of the problems, which might result in causing heart attacks in people less than 40 years. So I think this should be taken care in the root, taken care in its starting point, rather than just focusing on the final endpoint and saying working out is the last thing you should do. I think these are the basic causes which should be taken care of.
Very good. Very nicely explained. Super detailed. Very nice examples that makes things very easy and clear to understand, even for someone who is not a coach, even for general population. Very rightly said. And I think that fit people these days, majority of people look fit from the outside, but from inside they are not that fit. I have seen people who would prefer taking steroids just to go to a Goa vacation and to look good without clothes. Just for that small instance, they are ready and willing to take up steroids, which could be fatal for their health. But they don't look at the other side of that. They think that fitness is about how we look rather than how we feel and how we are from within. That is the very big component, I would say. Majority of the fit people that we see are dying due to heart attacks these days. They look fit, but their lifestyle, their mindset, the problems that they are facing through the stress that they have, sleepless nights, all of the alcohol, smoking, all of these things are setting them up for heart attack from multiple years before they get that heart attack. This does not happen overnight, that overnight you would certainly wake up and you will get an heart attack. It does not happen like that. They have a history from multiple years, even decades of doing all of the bad stuffs, and that leads them to an heart attack or to things like this, and not just the other way around. And rather media would be feeling good to push out something that is controversial, that is slightly going against the norms and something. So that is why I also think that people who are exercising fit young, they are getting heart attack, those news are published a lot these days. Rather than, nobody will be interested to watch a news where the media says that there was a fat person who was 60-year-old, used to drink alcohol every day, used to smoke a lot, and he died of heart attack. That is not something new for everyone. That is normal, and nobody is gonna read that news. So that's why I don't think most of those news also don't get published. Very good. So the
So Yeah, Vinay, just interrupting here, I would like to say about non-communicable diseases. So, non-communicable diseases in 2019, I think the estimated rate was 4.1 crore people died due to non-communicable diseases. 2019. After roughly 3 years in 2022, the non-communicable disease deaths, not the diagnosed cases, deaths went from 4.1 to 4.5 crore in just
Just
3 years.
sorry to interrupt you, Dr. Bilal, but could you explain us in detail what non-communicable disease actually means?
So this in 3 years from 4.1 to 4.5 crore, roughly 40 lakh people more have been dying due to non-communicable diseases, which are conditions rising from five basic things, which is poor activity, poor
Oh,
nutrition, intake of smoking, intake of alcohol, and complications because of this.
correct,
So, in a place worldwide where there are deaths happening more up to 4.5 crore in a year, people are not focusing that. Why? Because media doesn't portray that. So again,
correct,
coming back, we are the people responsible to create awareness. As doctors, they are responsible. As coaches, we are also responsible to create awareness so that people understand what is the actual scenario. And coming to steroids, there are multiple coaches I know in India who are very good in training clients with steroids,
correct,
but that is only for the professional part of this, where they do this as a job. And if a person approach me for the same, I'll say I'm not the best person for this, because
correct,
you start with something basic at your home. Be your best version naturally, because the hormones which you are putting from outside is already there inside your body, which is provided by God. So use that into your ultimate potential. Once you feel you have reached your potential and you don't have any other job and you want to pursue your career in professional bodybuilding, then again you hire a teacher who knows stuff on this, when to do your blood test, what all you should check weekly, bi-weekly or monthly, how to do this safely, what to do after a steroid cycle. If you hire a teacher for the same, then I'll say you're in safe hands, because we have examples like Jay Cutler or Ronnie Coleman or Phil Heath who has some problems because of their training. But
correct,
coming to steroid abuse, they don't have problems because they have access to these people.
correct,
This is the pathway
correct.
you should take. And we as coaches should portray more on the actual scenario, on non-communicable diseases and the actual problems people are facing.
Correct. Very, very, very nice answer to the question. Now, Dr. Bilal, what do you think as a young generation? We are a country of young people out there. What should we do to stop these things in the first place, to not get into insulin resistance, to not become obese, to not develop hypertension, to not let the things get out of our hands? Basically, how should we start the journey when we are fit, when we are healthy, not that fit and healthy, but when we are basically not having any of the problems? What should we do at that point? Because prevention is always better than cure. So what are your best tips for preventing their health from going out of their hands?
To identify that you have been provided with a human body, which is one of the best creations in this world. Correct. So
Correct.
again, coming to an example, a disease called spinal muscular atrophy, where a medicine costs you more than 16 crores. So
My god.
understand, you as a person who is hearing this doesn't have this spinal problem, which needs a medicine which is valued at 16 crore. So your body is 10 times or 100 times more valuable than this. So if you are a person who want to improve in your studies, who want to improve in your work, who want to improve in your family life or social life or financial life, you should start taking care of your health. So the first step, what is to recognize what you have been, what is provided by God. Second thing is to understand the fuel you put into this vehicle, which God has provided you with. So you can start with the basic things which your mother taught you in your childhood. That is, eat
Correct.
only from home. Don't eat too much from outside. Try to move more. And if you have peers or if you have friends, try to be active at least for 30 to 40 minutes a day. Because as a doctor, I have seen doctors in my hospital getting heart attacks sitting in their OPD.
Correct.
I have seen doctors getting seizures. I have seen doctors getting uh, hypertension, strokes as well. So, even if I talk to my community who are starting after their studies, they are starting as doctors. You handle a situation which is having the highest stress in this world. Even so, to take care of yourself, you start with putting the right amount of fuel in your system. And Vinay, you gave an example where 2 grams per kg body weight of protein is needed. But how will a person not used to that follow it? So start with what is easy for you,
Correct.
because the ultimate thing is discipline in life. So start
Correct.
something which is easy for you, which is easily available in your household. Don't make your parents buy protein or creatine or anything. Just eat
Correct.
normal food. Just train 20 minutes in a day, roughly 3 days in a week. Once you start doing this, in 3 to 4 weeks time, this is going to be a habit for you. You'll start seeing the mental changes in this. You will start seeing how confident you are. Once this is becoming a habit for you, you will slowly be consistent, and in a year this is going to be a discipline for you, where your day starts after taking care of your body, then you start taking care of others. We start with what is available in your home and what is easy for you.
Very, very rightly said. Very nice answer. Super detailed as always. Very easy to understand. We are social people. We have our families to take care of. And if we want to fill up the glasses of others, we first have to make sure that our glass is full. If we are unhealthy, how will we be able to take care of others? How will we be able to take care of our family? If we are sick, if we are unhealthy, if we are the person who are earning for the family, and if we are not in the right health, how will our family be taken care of? So start prioritizing your health, start prioritizing yourself if you are not already. This is the suggestion to all of the listeners out there. Going to the next question, Dr. Bilal, there has been a big news about the new weight loss drug. I think majority of people have heard about this semaglutide. Is it a magical drug for curing weight loss, and is it the problem to solve obesity worldwide? What do you think, Dr. Bilal?
And medicines is not the answer to cure anything or reduce anything. It is only one of the ways to mask the problem. I would use the word mask, so that for a short period of time it will mask your problem, because there are bariatric surgeries available to control obesity, but still
Correct.
there are a higher percentage of people after bariatric surgery they have diabetes and hypertension, which shows only their weight has come down, or physically when you look them they have trimmed a lot, but still they are a diabetic on insulin. So in the bariatric surgery was not needed in the first place. Same way, the semaglutide is a drug which helps in releasing insulin so that glucose is taken care of. And I have multiple clients, especially from the GCC, because in the GCC, especially in UAE, everything is covered in insurance. They are ready to take any sort of medicines. But this client of
Correct.
mine, who is a diabetic and a hyperlipidemic patient from 2016 for almost 7 years, he has been under 3 to 4 endocrinologists, many
My God.
gastroenterologist doctors, and for 7 years he's taking medicines for diabetes, for his high cholesterol levels, but still he is not come down from his obese state. So after the consultation with me, I said, why are you trying to mask the problem when you have a shortcut or an easy way how to reduce the problem?
Correct.
And he has been importing medicines from Bangalore to UAE because the medicines are not available in UAE. So in a place where we call the development is happening at its highest, people are still unaware of what to do. And as a doctor, I'll tell you, if you are trying to only on medicines, then be ready to take it for the rest of your life. You will have a box full of medicines. You will not be able to get up from your wheelchair. You will not be able to spend quality time with your grandkids. You will be in a wheelchair whenever you go outside. And that is not a life you people need. A life you need where what you do at your 20 years, you should be done at 60 years and 70 years. So
Correct.
the drug semaglutide, I will not say to take it. The only thing is, even if you go to Vinay's profile, my profile, or the people we know in common, we have proved multiple times again and again that this is possible.
Correct.
With a multidisciplinary approach, this is possible to reverse obesity or overweight or whatever lifestyle issue you have.
Yes.
Yes.
Very nice. Very great answer. Great answer, Dr. Bilal. So now I want you and your expertise from coaching process to coach someone. Now if we get a client who is overweight, who is struggling from all of these diseases, now how do we go ahead with it? What are your processes? What are the techniques that you use as a coach to reverse all of these things? Could you just give us a small insight about how should a coaching process look like, or how does your coaching process look like that guarantees results to all of the clients you are working with?
Coach or a lifestyle coach or a fitness coach should understand each person is different. So let's say a
Correct.
person with COVID infection is approaching to you. This 10 people have the same infection with the same virus, but the outcome is different. So I have
Correct.
people who have been coming after a COVID infection just with fever, but some will be post in the ICU for roughly 4 weeks or 6 weeks and can't even walk without the help of a CPAP, which is a machine giving you oxygen. So any lifestyle disease, first thing is to understand what is happening with them. So I start with a screening process separately for each person. So this screening process gives me roughly 100% picture on what is happening in their lifestyle. So let's say I'll give an example of my latest client who is 140 plus kgs, who has been in the ICU for more than 1 month, who has been post COVID infection, can't even walk now, need an oxygen cylinder and a CPAP to walk also. So for this person, I can't say them to run in a treadmill. I can't
Correct.
say them to do burpees, nothing. So for them, getting up from sofa is the biggest achievement in the first 2 months. So
Correct.
by sitting in a sofa, how to do a regular exercise, or the food which she likes, how to eat it on a regular basis. So that will be the approach for that person. But let's say a
Correct.
person like Vinay is coming for my coaching, who has a good background knowledge, who is who has an experience with coaching. For me, it is easy to coach Vinay, and I'll be more strict with Vinay. Why? Because he knows what is the importance of this. So the more strict I become, the more easy he'll reach the goal, and more easy we
Correct.
can reverse the problem he has. So each client, when I approach, let it be a 20-year-old male, 60-year-old male, bedridden, hand fracture, leg fracture, or bone disease, anything, we screen them before they come to the coaching. The 6 weeks, I call it a learning phase, where you are going to learn no matter how much experience you have.
Mhm.
Even if you are Mr. India, also you are going to go through the learning phase where you
Very
do things
nice.
slowly, steadily, analyzing everything. If you have lifestyle diseases, the basic blood works are going to be done. And after that, after the learning phase, based on your improvement, we take things further. So that in this first 6 weeks, we show that at least 1% of the goal would be achieved, and this is possible. They understand that what is not possible in the past 5 years happened in the first 5 weeks. So they are ready for
Amazing.
more, and they are ready to continue this for long. Meanwhile, as a doctor and as a coach, as I said 5 minutes back, I start giving awareness classes. So my first class is called the fundamental of fat loss. So they know what they are going to do. So they know what to expect. They know what are the basics of this process. And if they have asthma, I'll teach them the basics of asthma so they know what might go wrong, what they should be aware of. So that awareness should be created in your client or your student, and from there we should take them forward.
Amazing, amazing, amazing. That's really, really super cool process. And if we have a process like this, a lot of guesswork never happens, you know. Even with my coaching process, I have a very cool tracking process which considers not just the input that we are giving about the macros, about the exercise and stuff, but about the biofeedback markers of the clients as well, because weight is not the only progress parameter that we gauge the progress on. Okay, there is strength, there is the measurements, there are the biofeedback markers, like we have got their energy levels, their sleep, hydration, and their resting heart rate. We have got HRV, we have got a lot of devices that will help the clients to track all of these stuff, and majority of them do use a smartwatch these days. So even the basic parameter like a resting heart rate is very easy to gauge and very easy to take into consideration how much stress the client is, how his cardiovascular health is, and stuff like that, because it is a two-way process. It is not just about what we are doing, it is also about how the client is responding to the process, and the way the client is responding, we make changes according to that. And that is the best possible thing that we could do with all of the clients, because we know the bio individuality is still a factor. All, even if we follow the same plan, Dr. Bilal, you, me, and even a third person follows the same plan, we three are not going to get the same results out of it. We are going to get different results even if we follow the same plan. So that is why the tracking process is very, very important. I tell all of my clients that tracking is like a GPS in your car. Your transformation journey is like you are going on an unknown destination, and you don't know where and how you are going to go there, but you just know that there is a destination. And tracking is like the GPS in your car. The GPS is going to show you whether you are going on the right track, whether you are going on the wrong track, where the next turn is, where to stop, where to take a U-turn, where to speed up the process, where to slow it down, and all of those things. So tracking is a factor that I highly recommend all of the listeners to start doing if they are not doing. Okay, amazing. And the last question for you, Dr. Bilal, is that what are the things that you are doing at the moment that could make the life of nutritionist coaches and clients at the moment easier? Are you providing any coaching? Are you providing any classes for all of our listeners about how they could get in touch with you, how they can learn from you, and how you can make a positive impact in everyone's life?
Currently, what I'm doing with my lifestyle clients is I just don't just coach them and make them reach their ultimate potential naturally. Along with that, I give them classes. As I said, awareness is the best thing. As
Correct.
Vinay said, there are many progress trackers. So, what are the progress trackers you need? What are the fundamental of fat loss? What you should do if you have a sickness? So, the basic things a regular person who is not interested in fitness or who is not interested in being a health coach, the basic knowledge what they need is what I provide along with my coaching, so that in 6 months, I guarantee them that they will have more knowledge than the average gym trainer they have seen in their life. So that they
Awesome.
don't continue their keto diet, they don't continue their intermittent fasting, and they have answers for that. Secondly, for coaches, lifestyle coaches, gym trainers, I have started my school, an online school, which is named Dr. Bilal's Health School, where we start with basic anatomy of the human body. And from there, we progress over 12 weeks or 3 months to give the foundation, make the foundation rock solid, so that this will ignite in them the need of learning more. My course is not the last course in this world, but this will ignite a fire in them so that they'll keep on learning further, and they will have the foundation very strong, so that, as I said, the non-communicable diseases is at 4.5 crores in 2022. These coaches should not be responsible in increasing this problem.
Correct.
So if 10 people or 10 coaches are hearing this and 10 coaches are learning under me, one coach is taking care of 20 people, 200 people already are getting changed. So
Fantastic.
that is the next step what I'm doing in my health school, and the first batch is already started.
Amazing, amazing, amazing start, Dr. Bilal. And I congratulate you for starting your new venture. And I give you all the best and wish you succeed and come up with bright colors in the coming years. And we expect to see a lot more coaches like you, Dr. Bilal, who take up the ownership, who take up the responsibility of health of the clients that they're working with, of the people that they are surrounding with, of the people that they could influence and they could talk to. We need more of such responsible coaches out there, Dr. Bilal, and you are doing an amazing job in creating a new batch of such people. And super grateful to have you on my podcast. Thank you so much for the super valuable info and the knowledge that you shared with us. Thank you so much, Dr. Bilal.
Appreciate the time taken for this podcast, and thanks again for inviting me for this. And hope you get more people in this podcast and create more value through this podcast. And you're doing a good job.
Thank you so much, Dr. Bilal. I'll include the links of Dr. Bilal's Instagram and YouTube and whatever social media links he has in the description below. So just go ahead and stay connected with Dr. Bilal as well. He's amazing, sharing knowledge and value with all of us. And stay connected with both of us. I am as fitness engineer Vinay. Dr. Bilal is as Dr. Bilal on Facebook, Instagram.
Yes, Dr. Bilal Fit on Instagram, Dr. Bilal Fit Transformations also in Instagram, and Dr. Bilal Fit in Facebook.
Awesome, awesome. So that were social media links. I'll still attach the links below so that it would become easier for you to stay connected with both of us. And as always, my friends, if you have any doubts, questions, or queries, do drop it down in the comments below, or you can always DM me on my Instagram. I'm as fitness engineer Vinay, and Vinay signing off. Bye.